Hi, I'm John Baton, and I'm honored to moderate today's conversation. As someone who received a life saving organ transplant, I know how powerful and personal this topic is. In our community, there are real concerns and mistrust around organ donation. Today, we want to address those honestly and share facts so everyone can make an informed decision. I'm joined by two respected voices, Dr. Chile Aragatu, the Vice President of Medical Affairs at MedStar Southern Maryland Hospital Center, and Pastor Colin Pugh, the pastor of Clinton Baptist Church. Thank you both for being here. Let's get started.
John, I'm so excited to be here, and I'm grateful to be sitting amongst you and Dr. Chile.
And I'm super excited to talk about this important topic. Maybe we can get started, John, with you telling us a little bit about your story.
I'm sure. So I was living my life in Washington, D.C. One morning, I found myself being escorted to the hospital after passing out at work, and several hours later, waking up with a diagnosis of end-stage renal disease, which I learned that my kidneys had basically failed. And it was, to me, a huge shock because not so much that I had been diagnosed with kidney disease, the fact that I didn't know what it was. And what the kidneys did, it was a very traumatic experience. I found myself actually crying. That's how much in shock that I was. And then the whirlwind of being diagnosed, then being fitted with a catheter, then going into dialysis for the first time was another eye-opening experience to find yourself connected to a machine for 3 to 4 hours at a time, 3 days a week, was another kind of like traumatic experience as well. Fast forward a few years, I received my first transplant in 2009, and it was a transformative moment. I just didn't realize how much of a transformative moment it would be when all of a sudden I found myself waking up and my kidneys were functioning again, and I found myself able to live a new, vibrant life. I didn't have to worry about being connected to a machine. I didn't have to worry about going to dialysis. I didn't have to worry about multiple doctors, nurses, and so forth being involved. And then several years later, I found myself with my kidneys rejecting one more time, and found myself going back into the system again, which I was doing dialysis. And as I was doing dialysis, I made a decision that this time I wasn't going to be silent about it, that I was going to step out and become an advocate and a voice for people who I felt didn't have a voice, to share my journey about kidney disease, how I ended up where I ended up, and my experience with transplant and organ donation. And so I'm also one of those who, as I was doing dialysis, did every single modality of treatment, from in-center, nocturnal in-center, at-home dialysis, both PD and hemodialysis. So I have had quite a journey to end up where I'm at now. Now I found myself really participating in the community, and any chance that I have to be able to really talk to people, share my journey, share what they can do to, keep their kidneys healthy, and from ranging from just frequent doctor visits all the way down to sometimes what you eat. Yeah. So my second transplant came in 2019. And after that transplant, I just continued to live, and I'm at where I'm at now, working full time. I have my own consulting agency, and I feel great. And I'm sitting here with you guys today, continuing my mission of educating and talking with people. Okay, well, that's enough about me. I would now like to delve into some questions. And Pastor Pugh, I'm going to start with you.
Yes.
Can you share with us your perspective, both professionally and personally, with regards to organ donation and your experience in communicating with the Black community on this topic?
So one thing I want to say, that's an amazing story that you have, and I'm just in awe of what God is doing in your life. But for me, I'm here to change the narrative. I'm here to change the narrative to bring awareness to donations, because as growing up in the African American community, when we heard about being an organ donor or being in the presence of organ donors, it was always in a negative light. So I want to change that narrative in our community to let them know that this is not a negative thing. This is a great thing to be a part of, and how we should give back if we are healthy to be organ donors.
That couldn't be better stated. I found myself in the same situation. Dr. Ahagatu, as a healthcare professional, what are some things you experienced or heard on the topic of organ donation from the Black community?
Yeah, thanks for the question. I think it's a really important one. I've had the honor and privilege of working in various African American communities and other minority communities for the past 30 years. And during that time period, there has been a lot of discussion about organ donation in terms of the concerns that minorities have about participating in organ donation programs. A lot of this stems from a lack of understanding of what organ donation and what transplantation actually is, but it also has deep roots in the historical challenges that minorities have had in the U.S. healthcare system, creating barriers such as trust and willingness to engage in dialogue to understand what these programs offer. And so I think it's imperative to make sure that we provide resources for our communities to understand what organ donation is, what the benefits are of participating in organ donation programs, and the impact that it has not only in our communities locally, but around the country.
Thank you so much for sharing that. I really appreciate that. Pastor Pugh, have you encountered skepticism or hesitation from friends, church members?
Yes, all the time. I was talking to Dr. Chile and I'm telling him about just having a conversation with some younger people and around the age of 30 years old. And they was telling me how they have the lack of trust in hospitals. They believe that if I sign up to be an organ donor, that if I need to be resuscitated, I'm not going to be resuscitated because they want my organs. And they want to sell my organs. And I don't know where that myth came from, but I know it's a really big challenge in the African American community and the lack of trust when we talk about organ donors and even in the hospital.
Okay, amazing, wow. Okay. Dr. Ahagatu, what impact could greater participation from my community have on transplant outcomes?
Yeah, it's another key question, and this is part of the awareness and education that we're talking about in helping our communities understand the impact that we can have on availability of organs for the gift of life, as you talked about. So one of the things that happens when you have greater participation in a broader group of individuals in organ donation is that the organ donation pool becomes more diverse.
Okay.
And when the organ donation pool becomes more diverse, then the likelihood of diverse populations getting matches and being able to have access to these organs become a lot higher. And so not only do you increase the overall number, but you also increase the diversity of those donations, and so it makes it easier for folks to more likely get an organ if that happens.
Incredible. Wow. Okay. So this question goes to Dr. Chile. What resources or websites would you recommend for people who want to learn more?
Yeah, what I would say also is that it is important for us to continue these conversations. So I look forward to more dialogue around this important topic. But there are some things that we can do now, and one is to help folks understand where information is available, credible information is available. And I usually recommend the infinitelegacy.org website. There's a lot of information about the facts around organ donation and transplantation, but also there are a lot of answers to the questions and some of the myths that Pastor Pugh talked about to help dispel some of those concerns. And then also they do a good job of talking us through the steps that it takes to get an organ donation, and even if you wanted to sign up as an organ donor, you could actually do that at that website. Also, MedStar Health is renowned for its quality transplant programs and the comprehensive nature of our programs. And so the medstarhealth.org/transplant is another important website. And then also for those who might be interested in learning more about being a living donor, the medstarhealth.org/living donor website is also a great resource.
Thank you both for this amazing conversation. As we come to a close, before we do so, I'd like to ask you both to share some final thoughts and words with us.
Well, one, I'm thankful for being here. And as the pastor of Clinton Baptist Church, I want to use my voice that I have in the community to engage our community in dispelling some of the myths that we have around being organ donors. So I want to lead the charge with that. I signed up to be an organ donor because I know it's needed in our community, and I want to also help our community see that we can trust in the medical doctors and in the hospitals when it comes to this area. So I'm grateful to be partnered with Dr. Chile on this, and I'm thankful to be here, to use the platform that God has given me, that I can encourage our community to get behind this because it's important.
Yeah, well said. I completely agree with you, Pastor, about the partnership piece. It is imperative that we continue to build strong partnerships and then cascade our message into the community. I think as individuals, it is imperative that we commit ourselves to having knowledge about our health and our wellness. And all of the things that go into that, because at any moment in time, our health can change. Yes. And being informed and knowing what options we have is really critical. And organ donation is an important part of that. Understanding what it means to be an organ donor, understanding what it means to be an organ recipient, and what the transplant process entails. I think that's a really important message that we want to get out to our communities.
Thank you again to both of you guys for joining us today.
Yes.
It has been an amazing conversation. Thank you, thank you. Everyone out there, I want to just say, organ donation saves lives. It saved mine. Be sure to go to infinitelegacy.org for more information. Thank you for joining us.